Hey friends, welcome to Personal Success Coach. Today, we shall be discussing why you are not getting pregnant. So, you've been trying to get pregnant for a while, but nothing is happening. Why are you not getting pregnant? There are many possible reasons, including ovulation irregularities, structural problems in the reproductive system, low sperm count, or an underlying medical problem. While infertility can have symptoms like irregular periods or severe menstrual cramps, the truth is that most causes of infertility are silent. Male infertility rarely has symptoms. Please subscribe to our YouTube channel and click on the notification bell to be alerted each time we post a new video. Without further ado, here are 8 possible reasons you can't conceive. Firstly, not trying long enough. The first thing to consider is how long have you been trying. It may feel like you've been trying forever, and maybe you have. But it's important to know that many couples won't conceive right away. About 80% of couples conceive after 6 months of trying. Approximately 90% will be pregnant after 12 months of trying to get pregnant. This assumes you have well-timed intercourse every month. Secondly, you are not ovulating. Human conception requires an egg and sperm. If you're not ovulating, you won't be able to get pregnant. Anovulation is a common cause of female infertility, and it can be triggered by many conditions. PCOS is one possible cause of anovulation. Other possible causes include being over or underweight, primary ovarian insufficiency, a thyroid dysfunction, hyperprolactinemia, and excessive exercise. Most women who are experiencing ovulation problems have irregular periods. However, regular menstrual cycles don't guarantee that ovulation is occurring. If you have irregular cycles, talk to your doctor, even if you haven't been trying for a year yet. 3. Problem is with him, not you. Women may carry the baby, but it takes 2 to tango. 20 to 30% of infertile couples discover fertility factors on the man's side. Another 40% find infertility factors on both sides. Another thing you need to know, male infertility rarely has symptoms that are observable without a semen analysis, which is a test that measures the health of the semen and sperm. When you do see the doctor, make sure you are both tested. 4. Age-related infertility. For women after age 35, and for men after age 40, it can take longer to get pregnant. Some women assume if they still get regular periods their fertility is fine, but this isn't true. Age impacts egg quality as well as quantity. Also, if your partner is 5 or more years older than you are, this can further increase your risk of fertility problems after age 35. 5. Blocked fallopian tubes. Ovulatory cause accounts for about 25% of female infertility cases. The rest can have problems with blocked fallopian tubes, uterine structural problems, or endometriosis. In case you don't know, the fallopian tubes are the pathway between your ovaries and the uterus. The fallopian tubes do not directly attach to the ovaries. Sperm must swim up from the cervix, through the uterus, and into the fallopian tubes. When an egg is released from the ovaries, hair-like projections from the fallopian tube draw the egg inside. Conception takes place inside the fallopian tube, where the sperm and egg finally meet. 6. You have endometriosis. Endometriosis is when endometrium-like tissue, which is the tissue that lines the uterus, grows in places outside of the uterus. It's estimated that up to 50% of women with endometriosis will have difficulty getting pregnant. The most common symptoms of endometriosis include painful periods and pelvic pain at times besides menstruation. However, not all women with endometriosis have these symptoms. Some women who discover they have endometriosis as part of an infertility workup. 7. Underlying medical problems. Underlying medical conditions can lead to infertility in both men and women. For example, a thyroid imbalance or undiagnosed diabetes can lead to infertility. While it's not well understood, depression is associated with infertility. Some autoimmune diseases, like lupus and undiagnosed sexually transmitted diseases, can cause infertility. There are prescribed medications that may impact fertility. But never stop taking a medication without talking to your doctor first. Make sure both your doctor and your partner's doctor know you're trying to get pregnant. Also, an undiagnosed sexually transmitted illness can cause infertility. You may not have any symptoms of the disease. 8. Unexplained infertility. Between 10% and 30% of infertile couples never find out why they can't get pregnant. Some doctors say this is a lack of good diagnosis. They say there is no such thing as unexplained infertility but only undiscovered or undiagnosed problems. The fact remains, though, that some couples don't get answers. However, not having answers doesn't mean you can't be treated. You can, and should, still receive treatment for infertility even if your diagnosis is unexplained. Thanks for watching. See you on our next video.